लेकिन Good afternoon, all. Am I audible? Is my screen visible? Please mention in the chat box. So in today's session, we will be discussing on cardiovascular diseases, common cardiovascular diseases, risk factors, causes, prevention, treatment strategies, not in details. Okay. So anyone who is joining late, please help them out with the topic name. It's not in the textbook, just the topic name. Recorded sessions will be uploaded in the playlist as usual. So cardiovascular diseases. Cardiovascular diseases is a group of disease that affects your heart as well as the blood vessels, not just near the heart, even in the peripheral blood vessels in your legs, hands, extremities. Okay, so any disorder of the blood vessels also come under the cardiovascular disease group. So these diseases can affect one or many part of your heart or blood vessels. A person may be symptomatic, which means you may be seeing certain signs and symptoms. Am I audible? Is my screen visible? Okay. So the person may be symptomatic. They may be physically experiencing the symptoms, okay, discomfort of the disease, or they can be asymptomatic as well. They may not see any physical symptoms at all. Okay. So cardiovascular diseases include the heart or the blood vessels, issues including narrowing of the blood vessels of the heart, other organs, okay, or throughout your body. Narrowing of the blood vessels can be seen often. Heart and blood vessel problems present at birth, that is congenital heart disease. Okay, heart valves are not working right, like stenosis of the valves. Each one of this we will discuss in detail. And irregular heart rhythms, cardiac arrhythmias. Okay, so each one of them we will discuss in detail. Okay. So how common is cardiovascular diseases? Cardiovascular diseases is the leading cause of death worldwide. Okay, almost half of the adults who are in US have some or the other form of cardiovascular diseases. It affects people of all ages, sexes, ethnicities, and also socioeconomic levels. It's not that always a person who may be from an middle class family or an upper middle class family may suffer from cardiovascular diseases. Okay, 1 in 3 women and people assigned as female at birth, they die from cardiovascular diseases on a very regular basis. Okay, so this is the commonality factor of cardiovascular diseases. So causes of cardiovascular disease, or the etiology, okay, of cardiovascular diseases, it can vary depending on the specific type. For example, atherosclerosis, that is the plaque because of high cholesterol levels, plaque that builds up in your arteries, and it leads to coronary artery diseases as well as peripheral artery diseases. Okay, anywhere in your artery when the cholesterol is building up, that is what we call as plaque. Okay, so this disease condition is called atherosclerosis. So coronary artery diseases, it can scarring of your heart muscles because blood supply will be reduced, and the blood supply, and if the heart muscles don't get blood supply, it will undergo necrosis. Genetic problems or medications can also lead to cardiac arrhythmias. Arrhythmias means the rhythm of the heart changes, it's not normal. I'll show you some examples as well. Aging factor, infections, recurrent infection, rheumatic disorders, okay, they can also lead to valve diseases. So these are the causes of cardiovascular diseases. So what are the risk factors? Who all are at risk of developing cardiovascular diseases? People who suffer from high blood pressure, okay, and hypertension, high cholesterol levels, hyperlipidemia, tobacco use, including vaping, okay, and type 2 diabetes, mellitus, family history of heart disease. Okay. The progeny will also be at higher risk of developing heart disease early on in the life, and lack of physical activity, having excess of weight or obesity, diet that is high in sodium, sugar, and fat, overuse of alcohol, misuse of prescription drugs or recreation drugs like substance abuse. Okay, any drug abuse. Vaping is a way of it's very common to hookah and smoking. Okay, a specific vape device is there in which today's generation it's very popular amongst today's Gen Z generation. Okay, very similar to hookah smoking. Preeclampsia. Preeclampsia, it happens during pregnancy, high blood pressure, protein in the urine, edema all over the body, that is preeclampsia, toxemia, uh, toxicity in the blood, gestational diabetes, pregnant women who suffer from diabetes only throughout the pregnancy, that is gestational diabetes, chronic inflammatory or autoimmune conditions, chronic kidney diseases. Okay, so these all are the leading causes or risk factors of developing a cardiovascular diseases in the future. Symptoms of heart issues, very common symptoms. The first one is angina. Okay, angina means chest pain, angina pectoris, or simply angina, chest pain, chest pressure or heaviness or discomfort. Sometimes it is described as you have tied a tight belt around your chest. Okay, and it feels like there is a heavy weight on your chest. Specifically, if people who suffer from pericardial effusion, pericarditis, they usually tend to feel this, okay, this heaviness on their chest and tightness around their chest, okay. So that's another symptom. Shortness of breath, not able to breathe properly because of chest pain, okay, that is dyspnea. Dizziness or fainting, usually when heart attack happens, okay, these symptoms aggravately they show up. Fatigue or exhaustion, even with very less amount of physical activity, the person may feel fatigued or exhausted. Symptoms of blockages in blood vessels throughout your body. When you walk, you may feel pain or cramps in your legs, specifically the calf area or just behind the knee area. Okay, in these areas, when you feel cramps when you walk, or when you have done a lot of walking at the end of the day, when you feel cramps specifically at the calves of your leg and back of the knees, okay, that could be some blockages, peripheral artery blockages. Leg sores that aren't healing, cool or red skin on the legs, which means that blood supply is restricted. Okay. Cool toned skin in the legs, that means that blood supply in your legs is restricted. Swelling in your legs, okay, that is also another form of cardiovascular diseases. Numbness in your face or limb. This could be on one side of the body as well. Okay, that could be a risk factor of stroke. Difficulty in talking, seeing, and or walking. Okay, so these all are the symptoms of blockages. Some of the other blood vessels are blocked. If you face numbness in your face or limb, that could be that it could be a reason of blockages in the arteries that supply blood to the brain. Okay, cerebral aneurysm can happen. So these are the symptoms of blockages. Is it clear to all? Next is what conditions are cardiovascular diseases? First is arrhythmia. Problem in your heart's electric condition. We have sinus nodes within the heart. Okay, these sinus nodes participate in the electric conduction of the heart, which gives rise to the contraction and relaxation. Okay, the way how the heart is pumping blood. Okay, it is one of the reason because of that is the electric conduction through the heart because of the sinus nodes present in the heart. This can lead to abnormal heart rhythms of the heart rates as well if there is any problem in the heart's electric conduction system. So you can see here tachycardia. Tachycardia means increased heartbeat. The heartbeat is high. So how the ECG will look like? ECG, electrocardiograph. Okay, when you get admitted, they put the leads on your chest, hands, and legs, and they draw your ECG out. Okay, and if you get the ECGs very similar to a lot of high peaks very close to each other, tachycardia. Bradycardia, reduced heartbeat. Okay, the rate of heartbeat is very low as compared to normal bradycardia. Extra systole, there is a systole means when the heart is contraction, when the contraction is happening. Okay, that is systole. When the heart is in a relaxed state, it is diastole. So when the heart is pumping, it is contracting and relaxing. That gives the pumping effect. So when the heart is pumping, when it is contracted, it is systole. When it is relaxed, it is diastole. Okay. Am I audible to all? Am I audible to all? So systole, extra systole, and instead of diastole, diastole means instead of the heart relaxing, the heart will contract one more time. Actually, the heart should contract, relax. Okay. So before the relaxation comes in, the heart will contract one more time. That is extra systole. Okay. Is it clear? Then we have arterial fibrillation. That is the atrium. Just the atrium is not contracting properly. Okay. Regurgitation of blood may take place. Auricular flutter. Okay. Ventricular flutter. Okay. Auricular flutter is in atrium. It is the electric nodes are not functioning properly. In ventricular flutter, the electric nodes that passes electric conduction in the ventricles of the heart, it's not functioning properly. Okay, so these are the different types of arrhythmias. Using an ECG, a trained person who knows how to interpret ECG readings, they will come to this diagnosis and conclusion. Then we have valve disease. Okay, valve separates the atrium from the ventricles. Okay, how many chambers does the heart have? Does anyone know? How many chambers does our heart has? Your human heart has? Yeah, there are four chambers. The upper two chambers, right and left, upper two chambers are the atriums. The lower two chambers, right and left, are the ventricles. Okay, so valves will separate the atrium upper chamber from the lower chamber. Septum will separate the right side from the left side. Is it clear to all? I don't have the picture of the heart here to show the anatomy, but you can imagine. What separates the upper side atrium from the ventricle is the valve. What separates the right and the left side of the heart is the septum. Is it clear to all? On both the sides you have valves. On the left side also you have valve, and the right side also you have valve. Okay, because it is separating the upper chamber from the lower chamber. You have two upper chambers, two lower chambers. So you have valves on both the sides. Okay. So this is how a normal valve looks like when it is closed and when it is open. Okay. And this is how the valve stenosis is a type of disease condition where you can see there is an abrasion in the edges of the valve through which the blood can still escape into the ventricles from upper chamber to the lower chamber. The blood can still escape because it is not closing properly. Okay, and in valve stenosis, when it is open, it is not completely open, so the cardiac output is reduced in this condition. Okay, so tightening or leaking of the in your heart walls. um, the heart walls are the structures that allow the blood to flow from one chamber, upper chamber, to the lower chamber. Okay, so when there is any structural damage to the walls, definitely it will give leakage. Okay, automatically it would lead to leakage, or it will lead to reduced cardiac output. So these are the symptoms that happen in valve disease. Is it clear to all? Am I audible to all? Okay. Next, we have coronary artery disease. Okay, coronary arteries are the arteries which supply blood to the heart. Even though heart is pumping blood to the entirety of your body, heart also requires blood supply. Okay, that blood supply is given to the heart by coronary artery. Okay, so coronary artery disease, healthy artery, you can see here how it looks like. These are the coronary arteries and coronary veins. Okay, the red ones are the arteries, the blue ones are the veins. These are supplying blood to the heart. Okay, so this is how a healthy artery looks like, coronary artery. Slowly, when you have a specific diseases, infections can also lead to valve disease, heart infections. Okay, sometimes it is anatomical. Some kids are born with valve diseases. Infections can lead to heart diseases. Okay, chronic hypertension, chronic increase in cardiac stress can lead to valve diseases. Okay, so initial fatty deposits, here your diet is high in cholesterol and fatty acids, saturated fatty acids, and if it remains still high, along with family history, it runs in the family. Okay, this is how the plaque will create obstruction. You can see, compare the healthy artery with no blockages with the artery which has this yellow fat deposits that becomes plaque. Okay, slowly, nearly complete blockage, what happens is the blood that is supposed to reach the cardiac muscles are not reaching the cardiac muscles. Okay, it leads to necrosis. Cardiac muscles will start to shut down, and the heart will start to shut down as well. Okay, so this is coronary artery diseases. Is it clear to all what is a coronary artery disease? The concept of it. When we say coronary artery disease, is it clear to all? Next, you have heart failure. The problem with heart and pumping and relaxing function, that is again contraction and relaxing function of the heart. There is a issue there, leading to fluid buildup and shortness of breath. That is what we call as cardiac failure or heart failure. Okay, so here you can see, do the comparison between a normal heart, the way how the blood flows, and a heart failure. Okay, no, it is same. Atherosclerosis is same. Coronary artery disease and atherosclerosis can be used side by side. Okay, atherosclerosis means plaque formation in any area of the body. Okay, in coronary artery diseases, atherosclerosis or plaque formation is happening specifically in the coronary artery. That's the only difference. Okay, so here you can see the difference between the size of the left ventricle. Okay, and the in the cardiac failure heart, the size of the left ventricle is dilated. Okay, that it has been suffering from pumping and relaxing function, because of which the ventricle got dilated, it became larger, it expanded. Okay, and also the muscle tone here you can see this pink area, that's the cardiac muscles. Okay, the muscle tone is also relaxed here. It, over a period of time, it gets into a relaxed form. Okay, so there is a reduced supply of, there is a reduced pumping action of the blood. Okay, because if the cardiac muscles are really good in tone, they're able to vigorously pump blood through into the aorta. Okay, when the cardiac muscles are not does not have that vigor, okay, they are not able to fiercely pump the blood into the aorta. Okay, there will be a lack of efficiency. Okay, so that is what we call as a cardiac failure or heart failure. Then we have peripheral artery disease or PAD. In short, we call it as PAD. So issues with the blood vessels of your arms, legs, even abdominal organs such as and it leads to narrowing or blockages. So here also plaque formation, atherosclerosis is taking place, but at the peripheral arteries. Okay, peripheral arteries means arteries of your extremities, hands, legs, lower body. Away from peripheral means away from the central plane of your body. Okay. So that also leads to deep vein thrombosis or like any other situations as well. Next, we have aortic disease. So here, even your blood vessels have musculature. Okay, which gives it the vigor to take the impact of the pumping action of the blood. Okay, elasticity is present in the blood vessels. So what happens in aortic diseases? The elasticity of the aorta is compromised. Okay, problem with the large blood vessels that directs blood from the heart to your brain. Okay, this leads to aneurysm. This kind of a dilation, you can see this is a normal aorta. Okay, this is an aorta with a large abdominal aneurysm. This happened in the abdomen. This same situation can happen in the brain, and it can lead to stroke, hemorrhagic stroke, and so on. So uh, there is an issue with the elasticity of the aorta. Okay, because of which it expands, and over a period of time, if it keeps expanding, it may burst open, it may burst out, and that is a very critical situation. Then we have congenital heart disease. So here you can see, here there should be no abnormal pathway here in the septum. Okay, this is a septal disease, arterial septal defect. Okay, if this septal hole was here, okay, can you see my arrow moving? There should not be any communication between the right atrium and the left atrium. Okay, this is abnormal. Okay, when this septal defect, you see the opening here that connects the left atrium and the right atrium. It's not like that. It should not be like that. This is a defect. Okay, there should be no communication between the right atrium and the left atrium. If this septal defect happened downstairs, okay, in the ventricles, we call it as ventricular septal defect. Okay, since it is in the atrium, we call it atrial septal defect. Okay, so congenital heart disease, heart issue that you are born with, which can affect direct different parts of your heart. Here it is arterial septal defect. It can happen in the ventricle as well. Okay, and then valve defects. Okay, valve is the one that separates the upper chamber from the lower chamber. So the heart has two valves on the left and the right. Okay, so valve defects will happen here. Stenosis or any abrasions to the valve will happen here because valve will separate the atrium from the ventricle. Septum separates the right and the left side of the heart. Okay, is it clear? This is congenital heart disease. So the septum and the valves are, are the ones who divide the heart into four chambers, two atriums, two ventricles. Okay. Pericardial disease. What is pericardium? Pericardium, you can see here in a healthy person. Pericardium is a thin sheet, okay, that covers your entire heart. That is pericardium. Okay, it's kind of a thin sheet that covers your entire heart. So, any problem with this lining of your heart, we call it as pericardial disease. What kind of problems can arise? Either the pericardium can undergo inflammation. We call it as pericarditis. Okay. In another situation, this pericardium, the space between the pericardium and the heart, okay, it's a very thin space that can get filled up with fluid because of edema, too much of edema in the body, too much of swelling in the body. The space between the pericardium and the heart can get filled up with fluids. So that is what we call as pericardial effusion. Okay, so these are the two different types of pericardial diseases, pericarditis and pericardial effusion. Okay, in this image, I'm just showing you the pericarditis. You can see here the thin lining in the normal heart. When it gets inflamed, it becomes thicker. Okay, then we have cerebrovascular disease. Cerebro, brain, vascular, blood vessels in the brain. So diseases that takes place in the blood vessels of the brain, that is cerebrovascular. Okay. Issues with the blood vessels that deliver blood to your brain, such as narrowing of the blockages or aneurysm as well. Okay. Here they have shown you the examples of stroke. Two types of stroke: ischemic stroke, hemorrhagic stroke. What happens in ischemic stroke? So ischemic stroke, you can see here this white color mass that is blocking the blood. There is a blockage of blood vessels, and the blood is not able to cross over and supply the oxygenation to the brain cells wherever it is required. What happens? The brain cells who are not getting the oxygenation, they pass away, they die out, and it is irreversible. Once the brain cell is damaged, you cannot get it back. Once the neurons are damaged, they cannot be brought back. Okay. So this is ischemic stroke. It happens because there is lack of blood supply to specific areas in the brain and you lose the total functioning of that area. Okay. Then we have hemorrhagic stroke. Hemorrhagic stroke can take place out of aneurysm as well. Same in a lot of blood is getting pulled up in the blood vessels, and the blood vessels have lost their elasticity. Okay, they do not have the vigor to keep the blood inside. They may burst open, and the blood may bleed outside. Okay, that is hemorrhagic stroke, rupture of the blood vessels. Blood vessels may break open because of the lack of elasticity. So these are the two different types of cerebrovascular diseases. plaque. This is atherosclerosis, plaque. The same substance that can create blockages in your coronary artery, in your peripheral arteries, is the same substance, that is cholesterol, that can create this blockage in the cerebrovascular vessels as well. Okay. Is it clear to all what is cerebrovascular disease? Then we have deep vein thrombosis, DVT. Okay, blockage in your veins. So far, we were discussing majority of the disease conditions of the arteries. Okay, veins can also undergo certain systemic blockages. Okay, so blockages in the veins, vessels that bring blood back from your brain and body to the heart. Okay, they can also undergo some trouble. Okay, so healthy vein, you can see how it is. And in when the veins undergo change, structural change, okay, because of the lack of physical activity, obesity, weight issues, okay, smoking, tobacco, okay, these kind of issues. So what happens is that the vein will lose its elasticity as well, and the blood that is supposed to go up against the gravity, okay, because there is the lack of elasticity in the veins as well, they they are working against gravity. Easily the blood can get pooled within the veins. Okay, so this pooling blood will collect over a period of time, and it can become a blood clot, and that leads to thrombosis. Okay, so this is deep vein thrombosis. Causes we have discussed earlier in this class. Some of the common tests to diagnose cardiovascular diseases are blood work, okay, cholesterol levels, blood sugar levels, protein present in the blood. Okay, these are the common tests used to check. Ankle brachial index compares the blood pressure in your ankles and the arms to diagnose peripheral artery disease. Okay, so if the blood pressure in the ankles and the arteries are and at your arms are drastically different, okay, big huge gap between the blood pressure of these two areas, it means there could be a peripheral artery disease. Then we have EKG or ECG, electrocardiogram, that records your cardiac arrhythmias if you have any, okay, heart rate. Then ambulatory monitoring uses wearable devices that track your heart rhythm and rates. So ambulatory monitoring devices, you go to the hospital, they give you this device to wear for the next 1 day or 2 days or sometimes 3 days. Okay, it will track your blood pressure throughout all these 24 hours or 48 hours or 72 hours, and it will create a concrete diagnosis. Okay, so that is ambulatory monitoring. You don't have to like be confined anywhere. You have to just wear these devices, okay, on your arm or hand, okay, and go about with your day as regular, for 1 day or 2 day or 3 day, depending on how long the blood pressure has to be checked to find accurate answers. Okay, do you have high blood pressure in the mornings or in the evenings or in the nights? Okay, based on that, lifestyle changes can also be made. Then echocardiogram, you use sound waves to create the image of your heartbeat and blood flow. That is echocardiogram. It is used the UCG, okay, ultrasonography machine similar to that is used here. Then we have ultrasound. Again, here sound waves are used to check the blood flow in your legs or necks, to identify if you suffer from any deep vein thrombosis or any aneurysm. Then we have CT scan, cardiac computerized topography, uses X-rays and computer processing to create 3D image of your heart and blood vessels to find out aneurysm and to find out the model through which you can help this condition out. Then we have cardiac magnetic resonance imaging, MRI. It uses magnets and radio waves to create highly digital images of your heart, that is MRI scan. Then we have magnetic resonance angiogram or CT. Okay, it uses the combination of MRI as well as CT to find the blood vessels in your legs and head to identify exactly what is the extent of aneurysm or thrombosis that you are suffering from. Okay, again, it creates a 3D image. Okay, it is very helpful for the no, usually if a patient is admitted with atherosclerosis or plaque, etc., automatically these tests are prescribed. Okay, and if you're going for surgery, if surgical intervention is needed, these tests are required. CT scan, MRI scan, combination of CT, MRI. Okay, then stress test, treadmill stress test can be done. The person is put like uh, ECG leads will be plugged on the patient, and he or she will be asked to be running on the treadmill or walking on the treadmill, and see how the physical activity is affecting your heart. Is it changing your heartbeat? They're changing the heart rhythm, physical activity, just to find out that these tests are done. Stress test is done. Then cardiac catheterization. Here, a small catheter is used to measure the blood pressure and the blood flow in the heart. This will be inserted through the femoral artery, usually using the femoral artery. A small catheter, a camera-like device will be inserted to visualize the entire blood vessels and the heart health from it. So all the tests, is it clear to all? The meaning of all these tests and why these tests are done? All these tests are not required for every heart patient based on the symptoms, okay, based on the family history, based on the medications you were taking, based on the diagnosis, okay, to diagnose it further, to make the diagnosis concrete, these tests are prescribed. Coming to the management and treatment part, lifestyle changes, including your diet. If you have high sodium diet, reduce your salt intake. High caloric diet, reduce that. Okay, cholesterol based diet or animal products based diet, try to bring more vegetarianism in your lifestyle. Okay, try to switch ghee and butter with edible plant based oils or seed oils. These seed oils don't have cholesterol. Increasing your aerobic activity, like at least 30 to 40 minutes of physical activity like walking, brisk walking, that is more than enough. Quit smoking tobacco products, including vaping again, as I mentioned, it's a kind of smoking. Okay, the way how you smoke or the way how you use a hookah, vaping is also done in the same way. Medications, your healthcare provider may prescribe you medications to help manage certain symptoms of the disease. And medication will depend on what kind of disease you have, what is the extent of blood pressure you are suffering from. Based on that, medication is prescribed. That's the cardiologist's job to prescribe what, diagnose and prescribe. Procedures and surgery, if medications are not enough for your condition, you require more advanced care, only then surgical treatment is done. Okay, like placing some stent in your heart, pacemaker in your heart. Okay, minimally invasive surgery done through cath labs. Okay, open heart surgery only in if you don't have any other option. Open heart surgeries are done. Otherwise, as much as possible, all the vascular defects, everything is treated through cath labs. Okay, cardiac catheterization, ablations, cardioversion. Okay, cardiac rehabilitation. You may need to monitor exercise program to help your heart get stronger after surgeries. Okay, after medical intervention, you have to be very strict with your physical activity. Okay, and the report has to be given to the doctor as well. Active surveillance, be careful monitoring. Okay, have a BP machine at home, digital one at least. Have a digital BP machine at home. Don't miss your medications. Don't miss your appointments, doctor appointments. Monthly once or once in 3 months, get your heart checked. If you have a family history of it, or you are a cardiac patient, diabetes patient, any lifestyle diseases, if you have obesity, you're suffering from obesity, get your heart health checked. Prevention, avoid all tobacco products. Manage other health conditions. If you have type 2 diabetes, high cholesterol, high blood pressure, manage them. Achieving and maintaining a healthy weight. If you're overweight or obese, try to reduce the weight. Eating a diet that is low in saturated fat and sodium and cholesterol. Exercising at least 30 to 60 minutes per day on a daily basis or most days. Reducing and managing your stress levels also can have a good impact on your health. So that's about cardiovascular diseases. If you have any queries, please mention in the chat box.